All right. So thank you all for joining. We have today an AANMC webinar. So this is one in a series that we do every month. My name is Dr. Joanne Yanez. I am the Executive Director for the Association of Accredited Naturopathic Medical Colleges. And with us today, we have Dr. Brian Traynor. But before I make some introductions and go through, and turn it over to Dr. Traynor, just going to do a little bit of housekeeping. So if you can go to the next slide, please. So all folks here are going to be in listen only mode. There is a Q&A button that you'll find down at the bottom of your toolbar. And we just ask, please use that instead of the chat function, just so that we can track the questions and respond to you in a timely manner. Today is recorded, so if you miss a session or a piece of it, or you want to go back and hear a little bit more, you will get the recording at some point, hopefully today or tomorrow, once technology gods smile on us and let us get it over to you. So if you do have any technical issues, please email us at info@aanmc.org. And with that, next slide, please. So I'm just going to have a little poll here that will pop up for you on just letting us know and letting Dr. Traynor know who's joining us today. So if you can go ahead and fill out that poll. Next slide, please. So with us today, I'm very excited for the introduction here. We have Dr. Traynor. And so Dr. Traynor is somebody I've met actually at one of the first conferences I went to after the pandemic. And he grew up in New York State, was first introduced to naturopathic medicine by his Irish granny. We hear that often from folks, but I'll let Dr. Traynor introduce himself and talk a little bit about his journey. He also served as the Naturopathic Student President and has been very active in the profession and is now practicing in primary care and in his residency. And so Dr. Traynor, I'm going to turn it over to you. I'm going to put my face away. And so the show is yours. Take it away.
Okay. Well, thank you very much, Dr. Nez, and to the AANMC for having me today. Is my audio coming through okay?
It's perfect. Thank you.
Okay, great. So I'm looking at the poll and excited to see that it looks like about half of our audience is currently, or they're future students. So they're looking into naturopathic medical school or maybe other health professions. So, and about another 10% are current naturopathic medical students, and then about 25% are health professionals and a few other general interests in the topic. So I'm gonna go ahead and end the poll, and but that's great to see. So about half of I'll share the results here for a second. So like you can see, it's going to be great to talk to you all. I was recently a student and not too long ago was also contemplating naturopathic medical school and what that would look like for me. So hopefully we'll be able to have a great conversation here as we go through some things. So in terms of my background, I went to United States Military Academy undergrad to serve as an Army officer. After that, I was a kinesiology undergrad. So I had a lot of the courses to be eligible to apply for medical school, but I never planned on being involved in the medical profession. Potentially thought about physical therapy down the road, but as I'll share, I had a kind of a unique journey to find our medicine that I found out later was not all that unique. Many of us, it's our own health journey that does take us into this profession. And I have done since a number of other things to help with veterans since I got out of the military and into this field. So we can talk about that at some point. So today, like I said, I'll share a little of my story. I'll share what specifically brought me into pursue at least the beginning of my career in more of a primary care setting as a naturopathic doctor, which is, I can't say the norm, at least from Bastyr, California, that most of my colleagues have more so specialized early on, whereas I'm in more of a general practice as a second-year resident. I'll share a case that I think highlights how naturopathic medicine can fit really well into an integrative primary care model. And then we can talk about questions and what I'm doing in my career as we move forward. So like I said, just a few notes about my journey. I was an All-American triathlete and runner, so I put a lot of effort into that. I did pretty well academically, was recruited to run at a number of schools, mainly in the Northeast where I'm from, and made my decision based on that in part, that I wanted to be on a really good cross-country team and win races and things like that, while also getting a good academic experience. I didn't face a lot of adversity in terms of health or otherwise growing up. But 2 days after I graduated from college, I was hit by a car and fractured my femur. And that led to a lot of rehab and a lot of doubt about my career and what I was going to be doing. And it really made me question my identity as an individual, since I put so much effort into my physical ability. Being injured definitely made me rethink a lot of my priorities. 2 months after that, I began having digestive issues. It went from no issues, could eat anything I wanted, had a great digestion and bowel movements, to almost 30 bloody bowel movements within the span of 2 or 3 months. So I went from really healthy to really sick, and was diagnosed with ulcerative colitis, and didn't really know what that meant at the time. And I tried to hide it and ignore it. I went on some medication, but that's ultimately what led me to pursue a path into a medical field. Was ulcerative colitis was medically disqualifying for the military. So even though I fought it and tried to hide it, and 8 hospitalizations and multiple surgical consults, every medication possible that you can think of for ulcerative colitis, I used, until I found a naturopathic doctor at my school, Bastyr, California, who really helped me get started on a more natural approach. So I'm happy to share more about my story if people have questions, but it was ultimately naturopathic functional medicine that helped me heal my gut to the point that I didn't need surgery to remove my large intestine. I don't have a colostomy bag. I'm off all medication. When I was on Humira, Remicade, Entyvio, all of those, I've done some crazy things like fecal transplant and stem cells and all that, but it's truly been nutrition, lifestyle that have done the majority of the heavy lifting in my journey, along with some targeted therapies. I can also speak to my decision to pursue naturopathic school instead of osteopathic school, which was my path. I had taken the MCAT and was even accepted to a few DO programs, but I'm really grateful to be in the situation I'm in as a now young naturopathic doctor. And I wanted to share my story also. I did a few things with the American Medical Student Association, which is mostly MD and DO students. But I had an opportunity to do a month-long course with students that were finishing their 4th year of MD and DO school. And so I'm part of a cohort of about 20 MD and DO residents around the country that we stay in touch and encourage one another. So just wanted to throw it out there as something to consider, that yes, not every opportunity is afforded to us that MD and DO students and residents may have, but there's a lot more than you realize. And so part of my journey during school did allow, I basically asked to do things like that, and it worked out. So, and I'll speak about residency as we go. So, like I said, I'm a 2nd-year resident here in San Diego, California. I love what I do. It's not easy and there are days where I see patients that I understand how to treat them, men's health, certain gut things, and I see them, I get my chart done, everything's good. I send a good treatment plan, they get better. But primary care has really challenged me because anyone could walk in the door at any minute at our clinic here at the Center for Health and Wellbeing. They could have a host of health concerns, and most likely they may not have been treated for that yet, and they may not have been diagnosed yet either. So I think what primary care, my understanding is that it's really, the purpose of it is to provide a go-to medical home for every patient, that every patient would, unless there was a acute emergency issue that would lead them to go to the ER or urgent care, that they would first come see their primary care doctor. And that is my experience so far, a year and a half, year and 3/4 into this experience, that people will call us for the majority of their concerns. They also, being the first contact, meaning in someone's wellness decisions, implying that means that there is more to primary care than simply medications and referrals and things like that, that we really do, people trust us with their health, not just their sickness. And so I've experienced that as well. So I listed a few things that people are probably aware of. Think of when you go to your primary care doctor, what do you often do? We do physicals, we look at immunizations. I personally don't do very much with children. I do work with adolescents and up, but more so in specialty care, like for specific health concerns. So the majority of the primary care I offer is for adults. But as this is saying, many primary care clinics and many of the other naturopathic clinics I've shadowed in other states do a good amount of primary care for pediatrics. So that's something that if you're interested in is definitely an option in our field. And then women's health screenings and overall screenings like prostate exams, scheduling colonoscopies, all that is something that primary care typically manages. So I really wanted to add in, how does a naturopathic doctor practice in a primary care setting, and what do we add? And so this may be a review for many of you, and we will definitely, if it is, I'll kind of breeze through it, but I would encourage you, if you are a student looking to get into naturopathic school, really look at the principles. I didn't know much about the ND program before I got there. I actually, I think I made fun of homeopathy, which I love homeopathy, in my essay to get in. So since I have this opportunity, I would say do your homework, really try to understand what the naturopathic principles and the therapeutic order are. And I'll give a quick intro of how I see them and how they influence my practice. But I would encourage you to, look at some of the resources that we'll share as well. And in primary care, I apply this philosophy. And that's why I'm sharing it today, is that, in fact, I would say that naturopathic doctors are uniquely equipped to deliver primary care. And it's because of our principles and our therapeutic order. So, what is an ND? I've added a few slides of what I shared with my MD and DO colleagues, because none of them knew what I did when I met them 2 years ago in this program. So you may already know all this, but we are able to diagnose and treat in the states that we are licensed in, and there's every state look at understanding what the scope is, but we do have 4 years of medical school training, and residencies are an option to continue that training after. So the principles, this is a quick summary of the 6 principles of naturopathic medicine. First, do no harm, identify and treat the cause, treat the whole person, the healing power of nature, or the vis medicatrix naturae, docere, or the doctor as teacher, and prevention. And these are things that I get to apply every day to every single one of my patients. This is an explanation of each one of them, and I'll instead really look at how I incorporate this in my practice through the case that we'll go through later. But this is a good review, again, if you haven't been exposed to the principles that really are the bedrock for our profession. So I added this slide the next thing I want to talk about is our therapeutic order and how that impacts primary care. So this quote, I'll read it as we get into it. It says, anyone found to have used a strong herb when a mild herb would do, or a mild herb when dietetics would suffice, or dietetics when a lifestyle change would suffice, shall be disqualified from practicing medicine in the marketplace. So this is super old quote, but it highlights the idea of this, that there's actually a hierarchy to healing. There is an approach that works, that is built into the way that we were designed, our natural law. And so this is the therapeutic order. And we start here at the base. And in fact, when I was in naturopathic school, at the bottom of my charts for my primary care shifts, we actually said where our treatment plans were aligned with this. I don't do that anymore in practice, but I often think about it. And the residency group I'm a part of actually gave us posters to put the therapeutic order on our walls, so we can both look at it ourselves and have patients see what it is that where we're intervening in their health. And so establishing the foundations for health, I think the original term also put in the idea of removing obstacles to cure. That's a little bit of an old school way of saying it, but The two are usually the same, and I sometimes differentiate removing obstacles to cure and establishing the foundations of health. But this really comes down to a lot of what I hope many of you are interested in is lifestyle medicine, nutrition, exercise, sun, water. This is necessary. If we skip this step, no matter how if we can come up with the best plan to give the best herbs or even the right medications and be doing adjustments and things like that. But if we're not establishing a healthy lifestyle, stress management, all of that, we are not going to often get the results that someone wants. And so, yeah, and this is a conversation I have, I would say, on almost a daily basis. And I'm thankful that we are well trained in school and during residency to address this. The idea of stimulating the body's self-healing mechanisms is slightly different than determining or working on the determinants of health. And I like to think of that homeopathy often works on this level. I find craniosacral and visceral often works on this level. And oftentimes this is where I really see that patients aligning with their values and with their higher calling or their purpose in life is something that is needed to stimulate the body's ability to heal itself. Sometimes this is through meditation of really breaking down any barriers that patients have to healing. Some people are not ready to heal and their body is reflecting that. And so I love getting time with our elders in our profession, people that have been practicing in my mind for decades, because they really treat at this level really well. And it's something that our new generation, I would say, we have to be trained in. We have to actually spend time doing it, because we will get the pharmaceutical training we need if you want it. You will get the herbal medication, botanicals and herbs, and the newer PRP stem cells. You can get trained in all that. But this is what makes our medicine unique, the bottom. For those that don't know, we are trained in physical medicine in school. I use physical medicine often. I do craniosacral and visceral work. It used to be more on a daily basis. Now I'm doing a little bit less of that. I work with 2 chiropractors and 3 acupuncturists in my clinic. So I usually have them be the ones that really focus on the physical alignment. But as you see, it's not till about 5th in our decision-making process that we will even consider using a supplement or an herb, which is pretty amazing. And then further down would be things like medications, and there's a place for all this, right? There's a reason that we include all this in our approach. So that's a summary of the therapeutic order. I love it. If you want more information of how this emerged in our field, I would encourage you to check out some of these articles written by Dr. Zeff and Dr. Snyder, who are still practicing and still working in our field, and they're amazing. So if you get an opportunity to meet, like I said, anyone in our profession, especially those practicing longer, please do it. I would encourage you. So these 2 articles, that one, and then this one is an update of kind of its implications for research. Dr. John Fennell is also an amazing practitioner down in Texas that has mentored me, and I'm very grateful. So I'm sharing all this to say that the therapeutic order is our standard of care. It is what allows us to provide repeatable and understanding of what naturopathic medicine is, that it is very individualized, but there is principles and an order that we apply this in. And that is directly applicable to primary care, because we need to be addressing these wellness and lifestyle things so that patients heal. And if they need more specialty care, we can always refer. So that's what I would summarize that with. And just another quote that highlights, I think, the therapeutic order. Chinese medicine, I wasn't trained as much as many of you maybe if you are going to NUNM or SCNM or Bastyr. Many do dual degrees. I think that's a great option. Some of my colleagues that have done that are great. This idea that once you've resorted to needles and herbs, you've already failed. So even from a Chinese medicine perspective, using needles, acupuncture is actually way down on their list of how to actually help a patient heal or overcome a condition. So a good reminder, and I think the same is true in our field as naturopathic doctors. So I'll just hit on this. I also am finishing the process of becoming functional medicine certified practitioner. If you have any questions, you can ask me. I think there's a lot of value and I actually think the functional medicine approach allows us to apply our naturopathic modalities better. And it has for me, it's been a great framework to go into really gathering information from my patients and listening to them and then choosing where to intervene and not missing the lifestyle changes that are so necessary for healing oftentimes. So I just want to share that the functional medicine approach that many people may be wrestling with that idea. Should I go to MD, DO, PA, nurse practitioner route, and then do functional medicine training? I think it's possible to do that. Of course, I have some great colleagues that was their path. I will say that the two work really well together. So these first three places are really what the first three parts of the therapeutic order are what functional medicine really says are key to basically start the process of healing. So we're very much in alignment. Naturopathic doctors teach many of the functional medicine courses, and I'm grateful to be involved with both functional medicine and naturopathic medicine. I just listed some of the things that I try to apply every time I do a visit with a patient. Like I just got done with some and I have more coming up after this, and it's just exciting to even talk about what I do because I listed docere twice, or doctor as teacher. And I find that honestly, that's why many people come to us, because they not only want to be given a good treatment plan, and they want to get better and they want to feel better, but they really want to learn how to do that for themselves, for their families, for their friends. They want to know. And of course, I wouldn't encourage them to give medical advice to other people, but health advice, health is something that the whole family, it applies to everyone, applies to their friends. And so I often try to teach about health during our visit in a way that people can understand, and ultimately they don't have to see me as much. They can basically take what they're learning and apply it to their lives and get better and stay better, which is awesome when that happens. I would just say that one key that I have incorporated in my practice is really asking my patients what their goals are. And I do this I have it at the bottom of my template in my medical records, in my chart note. I just put patient goals, and they may have had chief concerns or chief complaints coming in, but realistically, their actual goals might not be related to that. So I really want to help them reach their goals, whether we do that right now, whether we have to focus on something else. I want to know what their goals are so that we're meeting them. And that sounds really basic, but I will tell you, I do think it's an art to best translate what we're hearing from the patient and their labs to then how do we affect that and how do we meet their goals. I've heard it said, not just what is the matter with you, which is often what a doctor will ask in other words, but what matters to you is really what we're trying to figure out as naturopathic doctors. And how can us advancing their health support them in those goals? I get here the conventional and specialty labs we can speak more about, but I run things through LabCorp request at the more conventional lab for almost every patient. And then if we need to, I will order stool testing, breath tests, food sensitivity testing. So I like that we have access to both, but I actually more often find that I start treatment before I have any specialty labs, that we will start in a direction. And then if we hit road bumps, then we will sometimes look to get more data. And it's surprising how much good data you can get from some of the conventional labs. And that's something that we focus on in primary care. Standard of care. I listed a few things here just to think about. The standard of care is something that is put forth by professional organizations. So in primary care, the American Academy of Family Physicians is often what is establishing clinical practice guidelines. And so how I explain to patients of what the standard of care is, it's really the idea that, how we fit into that is that we will first apply the standards of care, the best clinical practices of the conventional system here, and then we will go above and beyond. So standard of care plus is what I describe. Really what my practice is that we will be asking about when your last colonoscopy was, when your last prostate exam was. We will look at recent mammograms and encourage to be up to date based on the clinical practice guidelines from the AAFP. And but we will also look at the therapeutic order and how to advance your health in the best way. So standard of care plus is how I think of it. It's something that I would encourage you to look into more, understanding on the American Academy of Family Physicians. It's a great resource to have when you're going through school. And I would encourage you, regardless of which school you go to really start understanding what primary care guidelines are. And you don't have to have them memorized necessarily, but I would encourage you to use them in your clinical decision making in school to make it that much easier when you get out. I just like to throw this in because I think it's worth considering as many of you are starting your careers or your journey into health, is the idea that what does the word disease really mean? In fact, the word didn't exist, I think, until around 100 years ago. It used to be dis-ease. If you read old medical textbooks, like dis-ease. And I really like how one doctor has put it to me that I like to call things conditions, especially if they're chronic, instead of calling them chronic diseases. And I'll use myself, ulcerative colitis. There was a set of conditions that led to me developing inflammatory bowel disease. And some of them are genetic and predetermined potentially. However, it is conditional in that it's a condition in that it's conditional, in that there are conditions that led to the development of this, and there are conditions that could lead to the development of health and long-term healing and then long-term health. And so there's some stuff, there's an article online you can look up, why don't doctors use the word cure? Dr. Joseph Pizzorno, one of the founders of Bastyr, talks a decent amount about this. So I hope you get the opportunity to meet him if you're a student or soon to be student. I'll see him at the Environmental Health Symposium next week. I'm excited about that. But yeah, there's the word cure is worth considering. It was used in pretty much every form of medicine for centuries, millennium, and it's not part of our vernacular anymore, really, in the medical field. So it's worth considering as you start. What does the word cure mean to you? Is it in your language, and is it something that we see, or are we going to use the word remission all the time? So I won't share exactly, but I do think that I often will use the word remission, but I do believe cure is possible for many things, and it's worth exploring that. So where I land in terms of the word evidence-based medicine, because some will say, well, just they'll be looking at what we do in naturopathic medicine. And I really think that every doctor does this, even if they are saying that they're focused on evidence-based medicine. I would say that evidence-informed practice is really what the application of evidence-based knowledge. Ultimately, we are combining our clinical expertise, the patient's goals, with the latest research on that given condition or treatment. And so you'll see, what we see is that more doctors will rely maybe on their clinical expertise as they go. And I think that's healthy to rely on the evidence first and foremost. But I guess what I'm submitting to you is that all of these are true. It doesn't have to be one or the other, that, well, there's naturopathic medicine and then there's evidence-based medicine. You'll hear that term thrown out a lot, evidence-based medicine. I would submit to you that my practice looks like an evidence-informed practice, that I would be able to justify why I've done, and I do justify why I do every treatment I do or advise in the context of research, my own clinical expertise, that of my supervisors and my mentors, and not forgetting the patient expectations. So I hope that helps to add some framework as you are in school or getting started. We're wrapping up here before the case. Just the idea of billing insurance, it's something that looks, again, a little bit different in every state, but the way that things are looking now, you'll learn about this in school, so you don't have to get too caught up in it now. But basically, I would say that most of the patients that see me, the way our clinic is set up, we have medical doctors, nurse practitioners that provide primary care, and then within that, we are referred to in the practice to continue that primary care. And most patients that see me have at least 8 ICD-10 codes that are relevant to their care, if not more, and many, it's much more than that. So I basically document how I've addressed each one of those diagnosed or diagnosable conditions every time that, every time that I submit a chart note. So there's sometimes my plan will include 20 different diagnosis codes and 20 justifications of what we did to address that. So I tell my patients, because we have a thing called a super bill here where I have to circle and write for billing purposes. And sometimes people are like, well, you wrote down hyperlipidemia. I'm like, well, yes, your labs qualify for that. And this is how we're addressing it. So even though we weren't treating high cholesterol, we were treating their metabolic health. We will still code for the sick care model within the sick care model. So again, you'll learn a lot more about this in school, but I would encourage you to shadow at an insurance-based practice, as well as a cash-based practice if you haven't done that already, to see some of the differences and how it looks, because there's really not much that will replace that experience of shadowing and seeing how different practices have it set up. And I'm happy to answer more questions or have people come shadow at our clinic, the Center for Health and Wellbeing. And just one other note was this, there are billing companies that are very passionate about naturopathic medicine, integrative medicine, that, and that's one that we utilize here in California. And they've been, really helpful in guiding us. As a new resident last year, I spent a lot of times on the phone, letting them nitpick my charts and how I was documenting my visits with patients. So again, medically necessary is always the key. So even when we're running labs or providing any care, we basically have to explain the medical necessity of why we're doing that. Okay, so let's see. So I'm going to run through this case. I put a lot of slides. If you want, we can talk about them, but many of it is stuff that you'll get covered in school in terms of the lab values and all that. So we won't dwell on it. We're instead going to, I would encourage you to focus on how did this patient show up at our clinic and how did we provide both primary care and meet his needs and maybe some specialty care or advanced care, I would say. So yeah, this is my clinic. If you want to check out chwbonline.com. Here is, our mission, and this was all written before I got here, so it's cool that I just think that we say our vision is to provide integrative medicine that emphasizes patient-provider partnership and encourages the patient to take an active role in their health, and that the idea that we're bridging the gap between conventional medicine and alternative therapies. Again, it's not just MDs, nurse practitioners, and naturopathic doctors. We also have chiropractic, acupuncture, marriage and family therapists, IV nutrition. We have truly alternative, I guess, therapies, but I would go as far as say integrative and complementary as well. So I'm grateful to work in a place like this. A little bit about integrative medicine. Again, we've already kind of talked about many of these. All right, so our patient, 52-year-old male, came into my clinic, I guess it was fall of 2020. So I actually just saw him in the hallway, was it 2 weeks ago, and he was doing great. So this is, the first thing, but he came in really complaining of knee pain, and he was a little bit overweight, and we'll talk about the labs. He, since gaining this weight, he noticed that his knees would hurt a lot more after running, and he really enjoyed running. It was a stress reliever for him from his job, and he had some kids and his wife. So he found that the knee pain was holding him back from running as much, which then was potentially leading to more weight gain and lack of just feeling good and maybe some more thoughts around depression. He also took Advil almost every day for headaches. He also had right shoulder pain. And he just came in saying, well, I've had a past of high cholesterol, and someone said that I had fatty liver at some point, but I don't really know where I stand right now. So I was like, well, let's do I definitely think I can help you with your metabolic health. And I have some ideas of how we can also look at how are these things showing up in your body in terms of pain and patellar issues and things like that. So he had seen our nurse practitioner before seeing me. His wife referred him. That's very common in primary care. They say only about 27% of men could tell you who their primary care doctors are. Exactly 27%. I was kidding. So many men will not seek out primary care, and it's unfortunate. But I think when we get clinic like ours, where we get really good results and we provide really good care, oftentimes we do end up seeing the rest of the family. So that's how this patient ended up seeing me, is I had treated his wife for a little bit. So his goals were to lose weight, number one. It was to fix his knee pain, and he wanted to run a marathon it was 5 or 6 months at that point. It's like, okay, well, and he was not running at all at this time because of the pain. I was like, okay, well, 26.2 miles, let's go. Let's get you there. And then his goal was also to lower his cholesterol. Again, we hadn't had labs yet, but he knew he wanted. He assumed they were high. Maybe, I think he might have brought in results from 2 years ago, but I was like, let's get an updated panel. And then he wanted to make meaningful and sustainable lifestyle changes. And I think he shared that in the context that he had lost weight before, but hadn't kept it off. And so, yeah, he came in, he was 6 foot, 220. We didn't do his waist hip ratio. I'm not sure why I include that, but that puts his BMI around 29, which 25 to 29 is considered overweight. Above that is considered the obesity range. So, he was definitely heavier than he had been. We also use a tool for body composition that I find really helpful. It's called InBody, but there's many different tools out there. I encourage you to look into them. What I like about this is it's very trackable. It's not, the BMI is not a body mass index, isn't always the best marker of, to look at solely without context. So this adds percent body fat, skeletal muscle mass. Some athletes and things will use it for left and right extremity comparison. It gives a basal metabolic rate estimate. It gives a visceral fat level estimate. So really cool. So we did this, and this said that, his ideal weight would probably be about 30 pounds lighter. And so this was done at the beginning of our time together. We then ran labs shortly after that, and we saw a number of things. His glucose was in what I consider the pre-diabetic range. His liver markers at this point were not above the normal range, but I consider above 25 to be a sign that there is some amount of liver congestion or a need for support there. His fasting insulin, that's a fascinating marker. I encourage you to look into fasting insulin as a very good marker for metabolic health that often does not get run in a standard panel. But again, adding to the standard plus is where we see some of these extra markers. I consider under 8 to be healthy, under 5 to be optimal. Again, cholesterol, we could run just the normal panel, LDL-C, HDL-C, triglyceride, and total cholesterol. But we see that this is called an NMR lipoprotein analysis. Again, done through a conventional lab, nothing special, covered by his insurance, because he had a history of hyperlipidemia. And we see that, his LDL was 177, LDL-P 2100, which is a better marker, I would say, of LDL. We can talk about that. His HDL was borderline low. I like to see it between 60 and 80. Triglycerides, this is really, I like to look at the triglyceride HDL ratio. This was 4 to 1. I like to see it 2 to 1 or less, but really 1 to 1. So both in the 60 to 80 range. And then sizes of proteins and things like that, of the lipoproteins, is also relevant. We're not going to focus on today, but I encourage you, if you're interested in metabolic health, to do a deep dive on this while you're in school to better understand. Here are the markers that I looked at. His testosterone was 140. Now that's something that, if he came in for knee pain to most primary care places, they may not even check. But testosterone is key for our overall recovery and regeneration in our body. It promotes anabolic pathways that are needed when we're doing things like running that are going to break down our body. We also found that he was vitamin D deficient, which is not going to be helpful from bone and musculoskeletal health perspective. And we found his homocysteine was a little high, most likely from slight B vitamin deficiency. And we found that his estradiol was actually low too, which I don't like to see it too low in men. I like to see it actually in a better range, more like in the middle of the range from a bone health and then anti-inflammatory perspective. So I'm going to go through this real quick. His father passed away at 52, and as we said, he was 52. So this was really relevant. Taking a good family history really mattered here because his biggest concern was that, hey, am I going to have a heart attack? Like, I'm gaining weight, I'm not feeling great. My dad died of, a heart attack at age 52. I didn't know that when I first met him. Like, if I didn't spend an hour with him that first time, I don't think it would have been very clear that the underlying concern was really that. So adding all these extra labs allowed him to see his true cardiovascular risk. And since then, I've done more with coronary artery calcium scores and carotid ultrasounds to evaluate risk further, but that's not the focus for today. Again, he was on Advil. He was taking some over-the-counter multivitamin fish oil and some sort of fiber powder, I think. Yeah, this is past medical history. I just wanted to expose you guys to this, the health symptom questionnaire or other questionnaires. I just love using review of system questionnaires. This wasn't as relevant for him because it's such a low score, which I find a lot of times men underestimate what they're dealing with, but it's a different story. I like to use this. It gives me a way to then go back and look at this review of system. So in case I miss anything, sometimes people will come in and have specific complaints and they won't let me know, hey, I actually have seasonal allergies, which could be totally relevant to their case. So I use this with every new patient of mine. And then as a follow-up, I use it to somewhat quantify improvements that are seen beyond labs in terms of how is each system of their body working. I always do a nutrition summary, like a 24-hour recall with all my patients at a minimum, if not a full-on food journal with new patients. But this was just the first visit. He was having, two drinks a night roughly, and this was something that I do believe was delaying his healing, and we talked about. And he was avoiding red meat, which is, interesting to consider. And he was having tofu in his diet, which was interesting. So we worked on a lot of these things together slowly. He wasn't sleeping that great. He was, working out every day, but he was in pain. So I'm just going to skip through the rest of this so we can get to questions. But I'll just share what we did, basically. We came up with a plan based on those labs around middle of January. We got him on a therapeutic dose to raise his vitamin D levels first, since it's a very easy place to start. We didn't talk too much about his work stress, but I did put him on an adaptogenic formula to help him better manage the stress. Without measuring his cortisol and things, we can still, there's still a lot of benefits to doing that, especially to start, until someone has better habits to manage stress throughout the day, is a well-formulated adaptogenic formula, which you learn plenty about in school, which is, and you probably will need at some point, if not sooner. And sleep cycle, we like to track it. And I gave him magnesium glycinate. I find that the glycinate form specifically helps many people promote the GABA pathway and help them sleep better. And then this is where I liked it. We did a program that I put on for patients that wanted to lose weight, get healthier. That it was a 28-day cleanse, basically. And we had weekly check-in calls. We had daily thoughts and encouragement. So I don't do this all the time with my patients, but it was cool that his health journey aligned with this program. And we also have a chiropractor. We referred in-house to him. We did send, we considered some peptides in advanced care. And we did consider testosterone, but we didn't want to start with that and other support. So pretty cool. He really wanted to do new labs a month after doing this reset. I said, hey, I don't know if we're going to see all the results that we want, but you know what? We can run the labs. And I would actually normally wait 2 or 3 months of lifestyle changes at a minimum, but it was pretty remarkable. And he had drastic changes, and he did do a dry January. So once we did a dry month, basically stopped drinking. So that's one of the best ways to see people get the improvements they want. And so that's a an art of how to have that conversation with somebody that's probably using the alcohol for stress management. And so, or at least whether they say that or not, they most likely are. So again, pretty much everything improved. So hopefully these slides will be available. You can look at them and review them, but it was awesome. I mean, things were improved that we weren't even trying to improve through this reset. Like his total testosterone went up 100 points without us doing anything to address that directly. His vitamin D level in a month went up 14 points, which was great. His new BMI, he had lost, I think it was 10 to 12 pounds in a month. It felt sustainable for him. It felt reasonable, and he had lost some visceral fat. So it was all really cool, and it was cool to show him that of how it shifted. He lost, I think, 2% body fat. That's incredible in a month. So, yeah, he really liked the idea that I gave him a tracker. So there's so many great tracking apps out there. So our job is to not only, in my opinion, give the advice, but also the how-to. And I like to be as specific as possible in my recommendations. And we had a specific app that we used, and he loved it. So these were some things that he reported that improved for him, which was awesome. And some things that I just wanted to take away was that major metabolic changes can take place in a month, which is awesome. And like I said, I saw him a year later in passing, and he's still doing well. One thing I didn't add is that I did then send him for physical therapy as well, to not only get out of pain with chiropractic and then acupuncture also here at the clinic, which are great tools and can often set the conditions for health. But we also send him we have some great PT clinics near us that we partner with, and they really helped him with his running form and some key exercises to strengthen the muscles around his knees to prevent future pain. But we had options to do joint injections and other things that we could always increase on that therapeutic order, how we were approaching it. So I'll probably stop there. I mean, I've shared a lot. I want to mainly take questions now. So we have so many tools in our toolkit. I would just say, and also being a lifelong learner, I'm so grateful to have the opportunity to keep learning. And I tell my patients that, hey, I'm going to learn as best I can alongside you on this journey. I'll just mention, yeah, thank you to the Institute for Natural Medicine. I'm part of their residency consortium. We only have 2 here in California. The rest are in other parts of the country. And I'm thankful that INM is doing a focus on really training primary care over 2 years as a resident. So yeah, I'll be finishing in October, and I will continue to practice, and we'll see how I do. Yeah, so I will stop there. I have some, my contact information, and yeah. So should I look at I'm looking at the Q&A. I think we have about 10 minutes or so for that. Dr. Inez is there.
So before we go to Q&A, Dr. Traynor, thank you so very much. I really appreciate the information. And I know we've had questions coming in. We've been also kind of tacking as available. But would you be able to go to the next slide, please, just so we can announce the upcoming events?
Yeah, sure.
Thank you. So on April 5th, we will be hosting a virtual fair. This is an event where we'll have a number of different things. So we'll have an introductory to naturopathic medicine, and then we will have drop-ins available where students can enter in and go to rooms with all of representatives from all of the different programs. And then we'll have 2 panels. So we'll have a student panel with current students in the programs, as well as a panel of alumni. And so really excited day, lots, you can jump into any or all of it as you're free and able. And then at the end of April, we have another webinar, and this one will focus more on hormonal health. And so those are our upcoming events right now, and we're working on the rest of the year. So super excited for that. And with that, we will turn over to just a couple of questions. We only have time for a few here. So Dr. Traynor, can you speak a little bit to working in California? We alluded that the scope of practice is a bit different in some states versus others. And so how do you work within the scope of practice in California? And if you can just speak to that briefly.
Yeah, definitely. So Yeah, primary care versus insurance-based. So I do believe, so within the scope, we are definitely able to be true primary care providers. We cannot call ourselves physicians in California. That is one of the stipulations in the law. We do have a bill in right now. If you live in California, support it. Talk to your senator, look at the CNDA to hire nurses, actually. So there's some good momentum to update the scope, which is exciting. It's a good first step. Hire licensed vocational nurses would be the start for us. So if you're not involved with that, I would encourage you to. With that said, primary care does not mean insurance-based. And I didn't understand this when I was starting out, but we can truly provide primary care in the state of California, even if we are a cash-based approach. So we can refer to other specialties. We can provide that first line of care. Billing insurance is tricky, and it's not in the scope of this practice, but in this talk, I can talk to anyone offline about that. But it is possible. It's just not easy. So most people, there's such a need for what we do in California and everywhere that most of my colleagues that started their own practice, cash-based model, they started right away, and they're already full, and they're doing great. So there's such a need that all of the extra loopholes that it takes to do what we think of as primary care maybe is not really worth it for most people. I'm grateful to be part of trying to change that, but I think it's a slow process. Yeah, that's how I would answer that.
Thank you. So the next question, could you just describe, and I know we're almost out of time, so if you can just describe, what does a typical work week look like? What does your typical day look like?
Yeah, great question. So I typically have my schedule I look at for the week. On Sunday, I do a little bit of prep. I see patients 4 days a week. I see them Monday, Tuesday, Wednesday, Friday. I have Thursday. The Institute for Natural Medicine has a research requirement, a public outreach requirement, quarterly academic seminars, tracking requirements. So I'm grateful my clinic does give me a day to catch up on charts and admin and do all that. So that's how it breaks down for me. And most days it's typically 8:30, 9 till I'm done with patients by 5:30. But early on, I will say there were times where I was working probably closer to 70 to 80-hour weeks, but that was mostly because I was spending so much time researching treatment plans for patients. I'm becoming much more efficient in that while still providing great care. So I was working like all weekend on treatment plans and things like that. So right now, I think it's pretty manageable. 4 days a week of seeing patients, about 6 patients a day, sometimes less. And now I'm starting to do more like joint injections and things like that help break it up a little better than like all like long, harder cases. So, but yeah, most people come to me, it's pretty complicated. So 4 to 6 is what I would prefer to see in a day. Just managing my own energy, emotional energy. And my clinic sometimes pushes me past that. So that's what it looks like. Yeah.
Excellent. So with that, I think that we can go ahead and wrap up. We do usually end just a little bit before the hour on these so folks can get to their next event. There is a question. I'll stay on and answer a few additional questions just as folks, if you want to stay on, I can respond to some Q&A a little bit. I see that there was one Joanna is working on responding right now. But Dr. Traynor, thank you so very much for joining us today. Very much appreciate your time. We know how busy residents are, and really happy to have had the chance for you to share your experiences with the audience today. And we will also have this recorded and available if you missed it or want to go circle back and hear a little bit more. So thank you so much. I know you've got patients to get back to. Thank you, Dr. Traynor, for taking some time with us today.